The news from the front lines in the fight against COVID-19 is grim. Yes, a small number of vaccines are on the way to New Mexico, but deaths have barely abated and hospitals are really at their limit. So much so that Governor Lujan Grisham last week signed an order allowing hospitals to abandon their usual and legally required standards of care to move into crisis mode. And Eric, the state planned for this eventuality, certainly, but truly hoped to avoid it. What do you think hearing the news that hospitals might simply not be able to treat someone who has COVID, what's that going to do to behavior? Will that do anything? Is this a big enough deal for folks out there?
Well, I certainly hope so. I keep waiting for the thing that's going to make people to take it more seriously, right? And it's just, I'm still shocked that we can't wrap our brains around it, that we're still having this debate about, there's got to be a magic way to still get around the science, right? And it's just shocking to me how much abuse the governor and the public health folks have taken for just trying to protect folks. Like, I get it. Like, we support small businesses, but there's got to be, if we're ever going to get past this, we've got to agree as a community, as a species, that this is going to be hard for a while, but let's get past it so we can get back to normal life. And, this is yet another huge red flag, and I'm hoping I see changes in behavior. But every day I walk out to walk my dog and I'll see people, walking around with no masks. And I'm just like, what's it going to take? Mm-hmm. It's just, there's this cognitive dissonance that's still happening with a lot of folks here and all around the country, all around the world. It's not just a New Mexico thing, and I'm really worried that I hope this will finally hit home for folks, that we got to take this seriously. And if we do it just for a few months, right, we can get past this, right?
Well, the president-elect is asking for 100 days. And Senator Snyder, the concept of rationed care, that is just antithetical to most folks or anybody in the medical business. Have you been hearing from folks in the medical business? I know you deal with a lot of folks out there.
One of the things that they're happy about is being allowed, the standard of care is now, because we've got a shortage of healthcare who can deal with the COVID or are dealing with the COVID patients. Right. And so, and this is probably a poor example, but it would allow a pediatrician who is an MD to move over and meet that standard of care of taking care of COVID people. Mm-hmm. That if you have, and it would also allow retired physicians and nurses and healthcare providers of all kinds to come back in and help, because it allows a little flexibility of having the numbers of people, because that's one of the particular problems we have in New Mexico. We all know we don't have enough physicians or nurses or any of those people. So that does allow them a little flexibility. Mm-hmm. But when you get into saying rationing care and saying you can have it, but you can't have it, I think that becomes a very serious issue for the public. Mm-hmm. I think because one of the things they're saying is if you have underlying conditions, then you're not as likely, they don't believe that you would have as good a chance of surviving. And considering I have an underlying condition, mm-hmm. that kind of makes me a little concerned about that and worrying about how can we handle, and are we just saying, okay, all the old people won't get any ventilators or get care? And I'm not saying it means that, sure, but the public will think that at some point. So one of the things that I think we do need to do, and I did hear the New Mexico Medical Society say, is we have to have some protection, not of malfeasance, that's right, different, right, but protections because of the unique situation of the disease. So our healthcare providers need some kind of help.
Mm-hmm. Fair enough. Dan, the idea that big hospitals are under stress, you can't help thinking about the smaller hospitals in the rural parts of our state, and the ping-ponging back and forth. If you don't have beds in Quay County, you have to bring somebody somewhere, and that's probably going to be Bernalillo County, but we're out of beds too. You see the dilemma here? And so the same question I asked Eric, is this the final thing to get folks to change some behavior here?
No, I think it's just adding to, look, I agree with what Eric said. I mask up, socially distance, do mm-hmm. the things we need to do. I don't believe this is some, crazy government conspiracy. I will say that at all levels, both Republicans and Democrats on the government side have handled this thing disastrously. I mean, when you're hearing conflicting messages, when you're getting conflicting numbers, when you're hearing things like just the other day, I'm looking online and we're at 800 and something COVID beds in New Mexico, right? I mean, the hospital is full. We got 800 people. I think we hit 1,000 the other day. There's 1,000 people and the hospital's overflowing. Then you go online and you look at just the acute care beds in the state of New Mexico, almost 5,000. So I'm like, so if you got 1,000 people in there with COVID, do we have 4,000 other people in there with other things? And then there's constant anecdotal.
Well, there's the staffing issues that have to go with those beds. As Senator
but
Snyder
that's staff. Those, just so you know, Gene, those 5,000 beds that are on the Department of Health's websites is not the number of beds that are out there in a building. They're the number of beds that are staffed. It's the staffed beds. There's multiple more beds. There's a significantly higher number of beds that we don't have the staffing for. And which leads you to the other question, right, is why does it take this pandemic? We've been talking about doctor problems in New Mexico since I've been a kid, right? I mean, if it wasn't for the J1 visa program, we wouldn't have doctors in southeastern New Mexico in towns like Roswell. We have zero retention of keeping these doctors here. So I think that one of the things that I'm hoping is going to happen eventually is at some point everybody's got to put down their political spear and stop the fighting and say, okay, listen, how do we fix this? And let
me make a suggestion. Maybe it's about money. And let me ask Senator Griego
I think
about
money's,
that.
I think money's a big part of it, Gene. But I would also say I would say both sides have taken this crisis to politicize it, and I think that turns the average American off.
There you go. Senator Griego, the state announced a $100 million grant program that's going to be rolling out this week for businesses impacted by COVID, but it has to be used quickly. It's a short application window. Your sense of how the state has helped businesses and others here, is this too much, too little, too late? Is this just in time? What's your sense of the $100 million?
I feel like if you add the city stuff, the state stuff, there's a lot of federal money that's been dispersed. I think people have tried to help. I mean, obviously, it's a tough impact on small and local businesses, particularly, right? But it's not. It hasn't been for lack of trying to get money to them. I mean, there's also been some serious administrative and issues at the federal level in terms of some of that CARES Act money and the PPE money and so on. But I think that the frame of this has to be public health, not, there's a lot of dominance, like what are we going to do for business? What are we going to do for business? What are we going to do for business? We're in a public health crisis. So we got to be talking about fixing that, and then we can get back to business, right? So I do think that there seems to be this overemphasis on, geez, we just, what can we do? And so I'm hoping that part of this conversation is, and I just noticed in re-upping the federal CARES Act that they left out the paid sick leave. Like there's got to be a realization that we're never going to get the economy back on track as long as we keep sending sick people into workplaces, especially essential workers in restaurants and in retail and grocery stores, right? So we should be having this conversation in a much more comprehensive way. And it's not just about helping businesses through; it's about protecting public health and making sure workers can get through it, right? Because the economy is never going to recover if all your workers are sick.
That's a good point there. We're out of time on that issue. We're back in a few minutes to look ahead to the issues and faces that will take center stage at the state capitol next month.